Hi, I'm David. Welcome back to rdhblueprint.ca, Infection Control Part 2 for the Canadian Dental Hygiene Board Exam. You know what to do. Let's chalk and talk. Infection Control Part 2. Here, we're looking at our different class indicators, right? We want to see this paper go from this to this, from clear to colored over the sterilization process. Basically, our chemical indicators. How do we know the sterilization process worked? I thought this is a cute picture. It looks so neat. All right, classes 1 to 5. Chemical indicators are essential for monitoring the effectiveness of the sterilization process. Why? Well, we can't exactly put it on a microscope to see if it worked. So we want some kind of indicator on the package to say, was it sterilized before I touch it with clean hands? Right? We have them on the outside, we have them on the inside to make sure. So class 1, these are going to be external. It just confirms that the process was done. Usually it's just checking one thing, temperature, right? So we have indicator tape. So the tape on the outside of your cassettes, that's going to be a class 1. Class 2 has 2 words, which helps you tell it's a Bowie-Dick test. It's just meant for the Bowie-Dick types of autoclaves that are pressure. Okay, it's checking for adequate air removal. Steam penetration of pre-vacuum steam sterilizers. So it's performed daily on every type of sterilizer that's a vacuum autoclave for every type of load. Okay? Class 3, we have single variable indicators, reacts to one critical parameter like time or temperature. Less common now that we have better alternatives. Okay, so it was used, but I won't really use class 3 anymore. Class 4, multi-variable indicators, so time plus heat. Then it will light up for you, or it changes color. So time, temperature, and steam placed inside the package. So this would be inside of most of your, your little packages you put in. You stick your handpiece in or your Cavitron in, and then you fold it over and it sticks. That little packages, they'll have a class 4 inside. So if it's asked what type of indicator is this, it's class 4. Class 5, has all critical parameters, time, temperature, and sterilant for a specific sterilization cycle. And it's designed to correlate with biological indicators. We put inside each tray or package, and it gives us the highest level of assurance, our class 5. So while class 6 emulating cycle-specific indicators exist and are widely used, mainly we focus on class 1 to class 5. Okay? Autoclave testing is the gold standard for something being sterile. It's paramount. That's what we're always using, right? So we use a biological indicator, a living indicator. It's the most reliable method. So a BI contains highly resistant bacterial spores, and you know what those spores are. I hope you do. I hope your teachers hammered it into you. It's Geobacillus stereothermophilus. You need to know it. It could just say on the board exam, G. stereothermophilus. It could say geobacillus.s. You need to know it. That's what they're mainly using. Why? It's harmless to humans, and it's about as tough as other spores. It's a tough spore to kill, so it's great. If it can kill this, it can kill just about anything else. So they're processed and cultured to confirm the spore has been killed. It's performed daily. We test every machine, every type of load, every day. Chemical indicators, they're visual checks. They're internal or external that relates to one or more parameters, to be class 4 or class 5, used with every load to distinguish processed versus unprocessed items. Routine monitoring. See this ribbon here? That's an indicator. It's telling you it reached this temperature for this long, and that tells you, okay, the autoclave did work. We keep a record of those, either on a USB little thumb drive, or we keep the little ribbon of receipt there. So let's talk more about the spore test. It is the gold standard. We use Geobacillus stereothermophilus, which are significantly more resistant to sterilization than common pathogenic microorganisms. So a vial strip containing live bacteria spores, remember spores is like a hard little shell it puts on itself to keep itself alive, is placed inside a test pack, often with other instruments, ensuring it's exposed to sterilant under typical use conditions, or a PCD. It's put in a process challenge device. something that's hard for the steam to penetrate through. The test pack, along with normal instruments, is then run through a standard sterilization cycle in the autoclave. After sterilization, the spore is retrieved and placed into a special incubator, so we put it in something that can help it grow. If there's anything left alive in there, it'll grow on what we're putting you in. It's like taking a seed and put it in really good soil. Then we look. If there's no color change, that tells us there's nothing alive. The cycle was successful. And of course, we're taking one of those spores from the packaging, we're putting them in the incubator as well. We want to see it change. We want to make sure we didn't get a bad batch of spores from wherever we bought it from. So first we're taking 2 of them. One goes in the incubator and grows. Oh, good. We did start off with something alive. We do it through our PCD. It comes back. We run it again in that same fertile soil and it's dead. Good. The cycle is killing what it's supposed to. If the sterilization failed, the bacteria will grow, leading to a visible change in color due to the metabolic byproducts. Basically, when the bacteria go to the bathroom, they eat some food, they're eating the stuff you're putting them in, the agar, the sugar, whatever's in that little petri dish you're sticking them in, right? Or they're already in one, right? In the incubator. Therefore, we know if they're doing that, they're still alive. This should be performed at a minimum weekly and often have any equipment repairs or maintenance. The BI is the only test that confirms actual microbial kill. Chemical indicators don't tell you things have been killed, it just tells you what temperature or pressure it's been exposed to. This provides the only direct evidence that the sterilization process has successfully inactivated even the most resistant microorganisms rather than telling you it's been exposed to heat or steam. Remember, a pass means the results were negative. We want negative results. If they do a blood test for something, they say, oh, the results are negative. It means we didn't find anything. If we do a test and we say, oh, the test is positive, that means they found something. They found cancer. They found TB. We look for something like HIV. We didn't find it. They were negative. So if the test passed, the results were negative. If the results were positive, it means the test failed. Bowie-Dick for pre-vacuum autoclaves only. So air removal and steam penetration. 2 things. Was the air removed and did the steam penetrate everything? We run a test pack and the Bowie-Dick test is placed in an empty sterilizer chamber. It must be placed directly on the bottom front of the sterilizer. A dedicated pre-vacuum cycle is run, so it's a test cycle, and then we check. We check inside the test pack to see if it worked. A pass, an even, uniform color change across the entire indicator. That's good. That means the sheet, we have good vacuuming all over. An uneven color change tells you it was a fail. Now remember, this doesn't tell you that you have any bacterial spores on your instruments. It just means the test failed. Maybe it killed everything, but you can't be sure. Chemical indicator. This is a quick checkup, like strips or dots. It tests either heat, steam, time, or all 3. We have a class 1. We talked about that. It's the tape on the outside. Class 4 or 5 would be internal. Must be done on every load processed through the sterilizer. If there's no color change, that is a fail or an incomplete color change. And remember, with our class 5, there should be a little line that says that color needs to go past that line. It might not go all the way to the end, but as long as it makes it past the line, that class 5 is passed. You need to be checking the class 5 every time. If you're shown a picture of a cassette tray, or 2 of them, and they say which one is safe to use, and you're looking at the 2 cassette trays and you're not sure, look for if there's a class 5 inside. If you don't see a class 5, how do you know it worked? How do you know the sterilization worked? What is the number 1 reason for sterilization failure? It is overcrowding. That is the number 1 reason. Steam, chemical vapors cannot circulate properly around all surfaces. A bit like washing your clothes with too many clothes and not enough water. Your clothes won't come out clean. Cold spots form inside the load where the steam can't penetrate. Air pockets remain trapped in the wrapped packets or cassettes. So what do we need to do? All this follows the MIFU for load capacity. Space items out. They shouldn't be all stacked on top of each other. There should be space between each one so air can circulate. Check Class 5 integrators inside packs and Class 1 external indicators to make sure it was successful. And run your Bowie-Dick test in a pre-vacuum autoclaves. Top 5 reasons: overloading, improper packaging or wrapping, so you're rinsing the materials are too dense or they're wrapped in the wrong way, sealed too tightly, failure to reach the correct time, temperature, or pressure, that's a mechanical malfunction. Inadequate cleaning before sterilization, you still had blood on it, you didn't wipe it all off, so there's proteins on top, the coagulation of blood, and it's stopping the steam from penetrating down to all levels of that instrument. Another reason things could fail is autoclave maintenance issues. Clogged drains, faulty seals, or lack of routine service. They must be looked after regularly. Here's a quick summary. You can go over this, right? You got the PDF here. So step by step, what are the reasons why things fail and what do we do when they fail? Well, every office needs to have a recall procedure. Every office. If you see a failed test, what do we do? It should be written out. What could trigger a recall? Let's take a look. A positive BI result, so the spores are alive. A failed Bowie-Dick test. A chemical indicator not reaching the endpoint. So you've got your little strip there in your class 5. And there's the component and it only fills up to there. It doesn't fill up any more than that. Well, that's a failed chemical indicator. Autoclave malfunction or error codes come out. Package integrity breach. So the packets are wet, they're soaked through, not just damp, it's soaked through, or there's a tear in the fabric. Inadequate loading or incomplete cycle parameters. Documented deviation from sterilization. There are 7 steps now in the recall process. Now that we've had something to initiate this recall, what do? Identify the effective items. We are going to recall all items since the last pass. Isolate and quarantine. Remove them all immediately from use. Even if they're on somebody else's tray and somebody else is using them, grab them. Notify personnel, especially the infection control officer at your workplace. Patient identification notification. You need to notify people that they have a possible exposure. You can't say they have been infected. You don't know that, but you need to notify them. Hey, you may have been exposed. That's all we can say. Document everything. Document that you even called them. Re-sterilize or dispose of all instruments since the last pass. Investigate the root cause and implement corrective actions. What caused this failure? This may require maintenance, staff retraining, or protocol revisions. This is important, okay? Every office must have recall procedures. So a comprehensive guideline for daily sterilization and processing. We need to have this little checklist. Daily tasks, physical parameters, pressure, time for each cycle. Use class 1 chemical indicators externally. Use a Bowie-Dick indicator daily for pre-vacuums. Sterilize external surfaces on load carriers. Remember, nothing should be stored under the sterilizer. No instrument should be stored under there. Weekly tasks, perform BI for each sterilizing unit. Clean and sterilize the chamber racks according to the MIFU every time. Review water quality and review and sign off on all sterilization logs and records. There needs to be records of everything. Monthly, we should do a thorough clean of the sterilizer, including internal components like filters. Inspect gasket, valves, and seals for wear or damage. Review of sterilization records and BI results. And have refresher training regularly. That's what we need to be doing. Needle stick injury. What do when you prick your finger or your hand? We need rapid action. You do something very quickly. Okay, first, this is when you use antibacterial soap. You should not be using antibacterial soap unless you have a needle stick injury. You don't use antibacterial soap before and after each patient. Just regular soap. You don't want to be exposing yourself to antibacterial products. Okay? So we want antibacterial soap when you've had an infection. Do not scrub. Allow the wound to bleed freely if it's a puncture. Do not squeeze the wound. That's according to the Darby and Walsh, or the official guidelines. Why? Because you're crushing and destroying your cells within your finger, which then allows more of that pathogen to get through the cell wall. You don't want that. let your body bleed it out naturally. Incident reporting. Immediately report the incident to your supervisor or designated safety officer. Detail how did it happen. Get prompt medical evaluation. Less than 4 hours. You need to go. Baseline blood tests for HBV, HCV, and HIV will be performed for both the individual and possibly the source patient if they've been exposed as well. Adhere to the recommended post-exposure prophylaxis, the PEP, and attend follow-up testing appointments. We need to do that. This is important. It may not be fun to go on PEP, but you need to do it to make sure your own safety. What if you get a chemical in the eye? Always follow the MIFU, but every single SDS, every safety data sheet will say you wash your eyes for 15 to 20 minutes. There is nothing else. That's what you need to be doing. Water. Rinse out the chemical from your eye. You should have an eye wash station at every office. Seek urgent medical attention. Transport to an ophthalmologist. Continue irrigation during transport if feasible. Identify the chemical and retrieve the medical safety data sheet. And document everything. So here's a question for you. If the board exam asks, wash for eye or should you follow the MIFU, what should you do first? You get chemical in your eye. Should you go wash it or go get the MIFU? What would you do? And this is one I can't emphasize enough. Go with your gut. If you have something in your eye, are you going to go read a safety data sheet? No. You can't even open your eye. Plus, the safety data sheets, the SDSs, are all going to say rinse eye. So just go to the eye wash station first. Wash eye for 20 seconds or 5 minutes, it'll say. So MIFU is really only for the second step what you should do. Right? You have an eye wash station here. It's spraying her eyes. Here is a sample question for you. According to the CDHO, which of the following must be performed every day for a pre-vacuum steam sterilizer? A BI, thorough cleaning, Bowie Dick, or a review and sign off of sterilization logs and records? It's a Bowie Dick test. Okay? BI testing and reviewing is our weekly tasks, although you can do it daily. Sometimes it can just be weekly. That's what we need to be doing. Right? Little checklist. Understanding sterilization protocols. Bowie Dick is daily. BI is weekly, although often we're doing it daily. Right? Clean and maintenance is a monthly. And review log, we do those, review our logs weekly as well. So weekly responsibility. It gives an audit trail. Right, here's the autoclave and they're all steaming in there. Doesn't that look fun? Right, happy little steam. Disinfection versus sterilization. What is the difference? Disinfection reduces the number of pathogenic microorganisms, but doesn't kill all bacterial spores. Sterilization is complete elimination of all forms of microbial life. Okay? It's killing everything to 0.111 or whatever it is. Right? So in disinfectant, we're eliminating the most harmful organisms. In sterilization, we're eradicating all life. So we can't sterilize our fingers. We don't want to sterilize. We don't kill all life. That would kill us as well. We're using chemical agents like sprays and wipes. With sterilization, we're using steam, dry heat, or some type of gas. We're applying disinfection to non-critical surfaces, non-critical instruments, and it reduces but doesn't eradicate bacteria. For sterilization, we're using it for critical or semi-critical instruments. Right? Which one? Know it. Do we still use high-level disinfection? Not really. It used to be for people that we usually use heat now, right? High-level disinfectant still plays a vital role in situations where you can't sterilize. So heat-sensitive items, right? High-level disinfectants is reserved for those. They contact mucous membranes, but we can't put them in heat. Like dental endoscopes, an ultrasonic transducer, or plastic components. They can't take the heat. For all critical instruments, heat-tolerant semi-critical items, sterilization is mandatory. You have to do it. Best practice when performing HLD, strict adherence to the MIFU is important. It doesn't really come up that level. Do I think you have a board question about high-level disinfectants? Only that we don't really use them anymore. Okay, almost done. Let's go through our processing checklist. Have written policies. They must be written. Every office needs to have them. Easy, up-to-date, and access. Making sure everyone is adhering to the same thing. A recall system. We have a clear plan for what to do if the BI test comes back positive and we find spores. What do we need to do? We need to do daily biological indicating testing. I know this is confusing because some things say weekly, other times says daily. That could be American versus Canadian. I'm going with daily. If you get a board exam question that asks, go with daily. Class 5 indicators are used that we can release instruments before the BI is the results are back. So if it takes you an hour or 30 minutes for the BI result to come back, if a class 5 is in there, you can release the instruments even before that. Have a designated room flow from dirty to clean. Every room should have that. Storage restrictions. Do not store items under sinks, ultrasonic cleaners, or sterilizers to prevent contamination and ensure proper circulation of air. Have a dedicated hand hygiene sink and an alcohol-based hand rub, which needs to be 70% or higher. Eye wash station should be within a 10-second walk or be able to run for 15 minutes continuously for the eyes. For emergency use, always follows the MIFU. Spray and soak instruments immediately after use to remove debris before we do other processing. Ultrasonic cleaner, that should be changed. The solution should be changed daily or sooner if it appears dirty. Thoroughly dry instruments and wipe them with a lint-free cloth before the autoclave. Otherwise, if there's a droplet of water on there, the steam can't penetrate. Okay, the steam is much harder than that droplet of water and it can't get through it. They must have, all disinfectants must have a DIN, a drug identification number. Go to Pharm if you want to review what a DIN is to ensure regulatory compliance. Hinge instruments need to be kept open so all the steam can penetrate all the little cracks and crevices there. Remove the lumens. Detach and remove all lumens like mirror heads needs to be opened up so we can see inside there. That's what we want to do. For effective sterilization, all packs must meet specific criteria, including the sterilization date, your initials, and the number. They must be wrinkle-free to remain the seal remains intact, so you can't have wrinkled folds on the packaging. When you fold it over, it should be a neat fold. Have no tape applied to the pouch's sealing area that can compromise the seal. Be labeled only on the plastic side with the approved sterilization safe marker, never on the paper side. Otherwise, ink can bleed into the barrier, and that compromises the barrier. It won't be as good. Be loaded so cups face the paper side, not the plastic side, so steam can get on the inside of that bowl. Contain a chemical indicator inside with an external indicator visible on the outside. So they'll have one on the inside and outside. Remember, there are physical indicators, that's what's printed out from the machine, and a chemical indicator, that's the color on the pouches we're seeing or on the tape that's changing. Biological indicators, it's Geobacillus stereothermophilus, that's what we're looking to use in our BI, and a process challenge device, that's what we're putting the biological indicator in at the right part of our autoclave according to the MIFU to test. So basically, if it can work here, it can kill anything else anywhere. Bowie-Dick test is for pre-vacuum sterilizers, not every type of sterilizer. And here's the lumen. We're washing them out before we sterilize. Pre-clean the lumens thoroughly with brushes. Ensure the lumens are completely dry before sterilization. And position the lumens so their openings face the sterilite, allowing for effective drainage. Okay, that's it. Any questions, you can comment me if possible. And remember, there's questions online, do them and move on. Don't go over this chapter again and again and again. Once is enough. Okay, good luck on your board exam and let me know if there's anything else I can do to help. Cheers. Bye.